I'm Pat Salber, and I'm here at Health Datapalooza in Washington, D.C., and it's my pleasure this afternoon to have a discussion with Farzad Mostashari, who is the National Coordinator for Health IT. Welcome, Farzad.
Thank you. Glad to be here.
Great. And so you see what I have in my jacket here? I have I have a blue button on. And so what I'd like to ask you about is a little bit about the blue button and what it is and what it does. And then I would like to have you talk about an announcement that you made today, which is the Blue Button Patient Co-Design Challenge, which my company, Health Tech Hatch, is very happy to be partnering with you. So I'll let you take it from here.
Sure thing. Blue Button is the concept that you should be able to get your own data. So if you're on a website, if you're on your health plans portal, or if you're on your doctor's practice website or in a hospital, and you see a blue-colored icon looking something like that, that means I can click that and I can download my own data. It's really
so. What am I going to do with it?
Aha! So, you know, in the first instance, I mean, it's actually really interesting. The VA didn't do much more than that when they pioneered this blue button concept a few years ago. And they thought, you know, we'll just put it out. If someone wants to have it for whatever reason, sure, they can download a copy of it. You know, they thought they were going to get like 25,000 downloads. There have been 1.5 million veterans downloading their health information. So the one part of it is to download your information so you can share it with other providers. Because you may not have noticed this, but they don't always talk to each other.
Oh, gee, I didn't notice that. I happen to be one of those. But
So sometimes patients and their families actually, unfortunately, still today have to be the ones to be the couriers, to bring that information from one place to another place, to make sure the information that everyone who's taking care of them has the information they need. But what we realize actually is a much more profound opportunity, and what Datapalooza is all about is the idea that data becomes oxygen to innovation.
oh, I love that. Say it again.
Data is oxygen for innovation. Actually, a startup guy told me this. He said, there's just a lot more oxygen in the environment now. And by making that data available to patients, but also we then make it available to services and apps that the patient chooses to use. So I may get my data, and there may be an app now to help me manage my medications, to help me keep up to date on my vaccinations, to help me realize, my healthcare, manage my healthcare costs.
So you're turning data into actionable information.
That's the key. And the key to making that data come to life is letting it go.
And so.
Oh, right. So.
So
that
I put you on the spot. So what I'm really interested in, so you're going to have this challenge, and people are going to have the data,
yes,
and you're going to ask developers to design cool things with the data.
Solve some problems, but what problems should they solve? So
and how are you going to find out what problems they should solve?
Why don't we ask the patients?
Now that's an incredible idea.
Yeah, right. So we just announced today a co-design challenge. And the co-designer in this case, the co-pilot, is the patient. And so first, we're saying, instead of us saying these are the problems we want the developers to solve, we're going to crowdsource that. So up until Friday, people should go to ideas.healthtechhatch.com. And there they can, and there's already been tons of ideas people have put up there, but up until Friday, they can suggest ideas. I want to be able to do X, right? And then we're going to vote on it. And then next week, the developers, start up their engines and they start solving these problems. But it gets better, because as they develop prototypes of this, they'll be able to get what is so valuable to a developer, which is immediate user feedback. Immediate user feedback from real-life patients on the website who say, I suggested this, or I'd like this idea, but I don't like this, I do like this, this doesn't work, this doesn't work. So to be able to co-design in rapid iterative cycles, in that we're going to have developer forums, right? And we're going to announce there are going to be data sources. And this is the other cool thing is not only will there be Blue Button Plus, which is the structured part of this and the automated delivery of this information to the developers, but we're going to have data sources like the New York eHealth Collaborative who are going to make the data available to the developers to build on. So you have problems that matter, you'll have access to data, you'll have immediate user feedback, and at the end of that, you may get some cash if you're chosen as the winner.
It sounds brilliant. So I just want to say a few words about the patients, yes, because Health Tech Hatch, I'm the CEO, founder and CEO of Health Tech Hatch, and we are reaching out to patients. We've already had a lot of people express interest in and have signed up to be co-design patients. But if you're interested in joining, send an email to info@healthtechhatch.com, or you can come to our website, www.healthtechhatch.com, and sign up. And the process, this is not the first challenge that we've had the opportunity to do with HHS. And the co-designers that we worked with in the past really find this interesting, an opportunity to work with developers and share their ideas. It's really an idea whose time has come. Geez, somebody ought to ask me what I want.
Right, exactly. And one of the problems that there's tons of innovators out there who have gotten tired of building, cat games, right? Apps. They want to do something that really has meaning, but it's hard for them to understand what are the priority issues that they should work on that people really care about, and also what are the tools that are available to them so they don't have to reinvent the wheel on this stuff. So we hope to make both available to them. Problems that matter, but also some of the tools like the Blue Button that can help them just jump right up to a certain level of data manipulation, data access, data tools, instead of having to recreate all the problems about how do I get data from over here to over here in a field sector that I'm not familiar with.
So I'm going to finish just by doing a little future think here, because it's pretty amazing how fast things have been going in the last 5 to 10 years. I've been in healthcare for a really long time, and I've seen multiple failed efforts at changing the system. And now all of a sudden, really in the last 5 years, everything's changing. There's health reform, there's this incredible mHealth revolution, there's this open data, there are all the wonderful things that you're doing at ONC. What do you think we're going to see in the next 5 years?
I think we're going to see the streams of payment reform, how we pay for care, is going to be turned around so that we pay for good outcomes and good patient experience, not just for more health care. I think we're going to see the process of delivering care become much better at having the right thing be the easy thing to do for the patient, and having the default be you do the right thing, which it isn't at all today. And I also see patients becoming much better partners, having the information and the tools to be much better partners and participants in their own healthcare, and a healthcare system that begins to let them, to be open to the patient as partner.
Well, this has really been terrific. Any last word you want to leave with the audience?
Well, up until between now and Friday, make sure you submit your ideas to ideas.healthtechhatch.com.
I love the way you say that. Thank you very much.
Thank you.